Good day, I'm Dr. Ebony Lambito Alisa de Vesa, and I will be discussing about agoraphobia. So, agoraphobia is actually associated with panic disorder, but there are times that it is separated from diagnosis of panic disorder. And according to DSM-5 criteria, there are actually signs and symptoms that can be seen with patients with agoraphobia. So what are these? But before that, I will actually tell you about stories or experiences with patients who are having agoraphobia. So there are people, there are times that they cannot detect or agoraphobia can go unnoticed. So for example, there are times that you are just afraid going out of the house alone. So, yung sa iba, iniisip nila na that person is dependent, no? Nagdidepend siya sa'yo to go out of the house or something like that. But those who are experiencing agoraphobia have difficulty going out alone because they have fear that if something will happen to them outside the house, no one will help them, okay? Like for example, iniisip ko na if lalabas ako sa bahay, atakihin ako sa puso or kung anong mangyari sa akin, sinong mag-help sa akin? If magpapanik attack ako sa labas ng bahay, anong gagawin ko? Sinong tutulong sa akin? Something like that. A lot of actually thinking errors that is happening, and it can be catastrophic with regards to magnifying something that can happen, worse that can happen, but it's not yet happening. So, meron naman na for example, lalabas sila sa bahay, tapos natatakot sila na baka kung anong mangyari, pa ganon, or nag-a-ask sila for their relatives or family members o bro o sister mo or tita or tito na pwede mo ba akong samahan na pumunta or magpa-check up, or pwede mo akong samahan pumunta dito kasi I feel more relieved if may kasama ako, okay? That person would feel at ease if may kasama sila because that would make them feel comfortable and make them feel safe kasi may kasama sila. Whatever will happen, they have some companion or someone to help them. Ganon. So, for example, okay, paglabas mo sa bahay, may kasama ka. Tapos, pumunta ka sa isang open space, no? Open space na siya, no? So, yung isa sa mga criteria for agoraphobia is open spaces. So, pag open spaces, meaning sa labas ng bahay, okay, you are afraid to go out, no? Natatakot ka. Okay, baka mag-panic attack or gano'n, nagpalpitations, may anxiety, namumutla ka, nagiging stiff yung katawan mo. Okay, so open spaces, okay? And then aside sa open spaces, crowd, okay? You are afraid of the crowd pag may agoraphobia ka. So pag nasa crowd ka, yung feeling mo na baka hindi ka na makalabas or you are afraid na kung ano mangyari sa'yo doon sa crowd na yon. Okay, so hindi ka comfortable with a lot of people, and people, especially sa crowd, maraming tao. So, mga gatherings, for example, na may banda, may birthday, basta maraming tao. Or, for example, going out sa mall, okay? So, hindi ka comfortable with that, okay? Kasi crowded yung places. So, aside from that, going inside an enclosed space will make you also uncomfortable. So, enclosed spaces, yun so isa sa mga criteria. Enclosed spaces na akala mo hindi ka din makalabas, okay? Yung iba, feeling nila hindi sila makahinga, baka anong mangyari sa kanila, hindi sila makahinga, ano ba to, okay, nagpa-panic attack sila, ganon, okay? If you don't know about panic attacks or panic disorder, please watch my video about panic disorder. Okay, so please watch my video about panic disorder. Suggestion ko lang. No, walang pag-force doon. Okay? Pwede din yung pag-enclosed spaces. Pag specific lang sa enclosed spaces yung fear mo, then it's not agoraphobia. It's more of claustrophobia. So, ano yun? Specific phobia siya. Okay, so but when we say agoraphobia, so yon, going out of the house alone, fear of open spaces, fear of the crowd, okay? Okay, so yon. Okay, so pag agoraphobia, yon, yung fear of going out alone, fear of open spaces, fear of crowded places. Actually, pag falling in line, may times din yung iba natatakot sila, kinakabahan, okay, napapalpitations, hindi makahinga, nahihilo, parang nagnanamb yung kamay, o sweaty na siya, ganon. Parang anxiety actually yung mga symptoms niya. Okay, so if you want to know about more about anxiety, I have a lot of videos about anxiety disorder, so please watch, okay, aside from panic disorder. Okay, so yon, sweaty yung hands, and then yung enclosed spaces, no? Pag sa enclosed spaces lang, specifically yung fear mo, then baka claustrophobia yon. So pag agoraphobia associated with other symptoms, okay? So, okay. So, yon, pag enclosed spaces, natatakot ka, hindi ka comfortable, okay, you want to go out, yung iba gusto nang tumakbo, or ganun, grabe yung palpitations, yung sa iba eh. Tapos, after that, public transportation. They also have fear about public transportation. So, that means, public transportation, yung sa jeepney, sa taxi, yung iba sa taxi, no, or sa MRT, LRT, okay yun. Basta public transportation. Yun din yung fear nila, na hindi sila makalabas, or especially na pag nasa dulo sila, nang malapit sila sa driver, no, pag nasa jeep ha, parang gusto nilang lumabas. No, kakasakay pa lang, pero hindi na sila comfortable. So, gusto na nilang lumabas. So yun, pag agoraphobia, you are actually afraid of going out alone. So, gusto mong may kasama ka, hindi ka maka-move on with your life, or I mean, hindi ka maka-move on, you're going to a certain appointment or destination. Yung 1 kilometer, before 1 kilometer, hindi ka na comfortable kasi wala kang kasama. Tapos, open spaces, hindi ka na comfortable with open spaces. Tapos, pupunta ka pa sa crowd, sa mall, sa mga birthday gatherings, sa disco, sa lahat, okay? Basta crowded siya, hindi ka comfortable din doon. Okay? Pag enclosed spaces, like for example, nasa kwarto ka or nasa public transportation ka, for example, then you're afraid of public transportation. So pag sumasakay ka sa jeepney, yung iba sa taxi nga eh, LRT, MRT, sa tren, or okay, sa train, no? Okay, so hindi ka comfortable with those public transportation kasi yung iba may feeling nila hindi sila makahinga, parang natatakot sila baka hindi sila makalabas, anong mangyayari sa kanila. Okay, there are a lot of negative automatic thoughts happening with that person with having that agoraphobia, no? So yun yung mga criteria for DSM-5, no, for agoraphobia. So pag check, okay, fear of going out alone, check. Open spaces, check. Yung sa iba, yung nagfo-fall in line ka, yung iba doon minsan na may anxiety doon. Okay, so open spaces, closed spaces, crowded place, tapos public transportation. So, yun yung mga criterias for agoraphobia. Yung iba na-tolerate nila, especially na if mild lang naman. Pag mild kasi, hindi naman ganun ka-interrupted yung relationship, yung work, or any performance mo. Unless it's very severe, na nakaka-experience ka talaga ng panic attacks during those times na na-expose ka with those triggers, mga crowded place, pa ganun. So, yung may mga patients kami na, for example, lumablabas sila sa bahay. So, nag-ask talaga sila ng kasama. Okay? So, pag nagpapa-check up, gusto nila may kasama sila kasi mas comfortable sila with that. And then, yung iba, mas prefer na kahit na medyo magastos, no? Either private na transportation o yung car, or mag-rent sila ng car or mag-rent sila ng taxi, yun. Magta-taxi sila, tapos hindi nila gusto na for example sa outpatient department namin, maraming patients, no, gusto nila yung talaga, konti na lang yung patients before sila pupunta, okay? So, yun yung mga ano nila, yung mga struggles nila. And then, there are times na, yun yung panic attack. Kasi pag panic attack, sudden naman eh, hindi naman kailangang may trigger. So, yun, nahirapan sila. Actually, pagpasok pa lang sa outpatient department, no? Kasi closed space, kasi room siya eh. So, mas relieved sila if open yung door sa outpatient department, no? Open yung door, or if may curtain sa cubicle, i-open mo na lang para mas feeling nila, mas comfortable sila pag ganun. Usually, we also encourage them to do breathing exercises, no? So, mas better na mag-breathing exercises ka para maano yung body mo to give a response na you are not in a fight or flight response, na you are safe, no? And i-assure mo din yung patient na yung mga symptoms na yun is part of agoraphobia. So, yun, breathing exercises, tapos awareness exercises. Minsan nag-encourage din ako meditation. Tapos, yes, we start with medications kasi para mag-calm yung patient. So, for long term, we give SSRIs, so serotonin selective reuptake inhibitor. So, usually like escitalopram or other medications. Tapos, nabibigay din kami ng benzodiazepine. So, diazepam or most commonly nag-alprazolam kami, but we don't usually encourage them to take it every day unless if grabe yung or severe talaga yung panic attack. So, yun yung mga management namin for agoraphobia. And we also do cognitive behavioral therapy. So, common talaga yung cognitive behavioral therapy because most of the mental disorders can help. Maraming studies na helpful yung cognitive behavioral therapy. Okay, so I have actually prepared a cognitive distortions or common thinking errors that you can actually watch na kung ano yung mga pwedeng mga thinking pattern mo kung bakit ganun ka mag-think, bakit catastrophic, ano yung catastrophic. Kasi usually yung sa mga anxiety, yun yung mga thinking nila. Minamagnify nila ang situation kahit na hindi pa nga nangyayari or less pa yung actually yung pwedeng mag-cause ng harm, pero minamagnify nila. So, pinapalaki nila na akala nila end of the world or parang ganun yung feeling. Actually, most of the time, di kasi nila makontrol. So, mas maganda talaga if matreat sila with cognitive behavioral therapy. So, we do that sessions and we encourage you, if especially those who are having difficulties with work or relationship because of this kind of mental disorder, which is agoraphobia. I want also to correct misconceptions kasi yung iba, iniisip nila pag they go to a psychiatrist, the term is buang, no? Buang ka na or ano, parang ganon. Stigma, we want to stop stigma. That's why one of the reasons why I am explaining this to you because mental disorders doesn't mean pag sinabi kasing buang, it's something like psychotic, but it is discriminatory term, no? If we really strictly follow mental health law, pwede silang makondemn those who are discriminating people who are suffering from mental disorder, and they call them names, no? Like for example, buang ka, ganon, dahil nag-take sila ng medications due to psychiatric disorders. Pero hindi naman yon. So, stigmatizing kasi yung ganito, infancy period pa lang sa Philippines yung mental health. That's why we are advocating mental health for all. Kasi there are a lot of disorders na pwede naman actually ma-prevent prior na ma-develop siya, no? Prevention is better than cure. So, if you want to share information, please share it. And sana maka-help din sa family mo. So, mental disorder siya, but it doesn't mean yun, buang ka. So, ganon. So, pag sinasabihan ka ng tao na ganyan, tell them na according to mental health law, that is against the law. If you're telling that to me, that is a degrading word, discriminatory action, and you can be filed a case, or you can actually be against the law. Okay? So, pwede kang mag-file or magpa-blatter someone who calls you that because you're taking medications. Kasi against yon, no? Hindi mo, katulad din yan ng mga PWD, no? Hindi nyo pwedeng discriminate yung mga person with disability, yung may mga putol ang kamay, bula, ganon. So, ang mental health law, ganon din. Kasi it's also disability din if you have mental illness. That's why we also encourage our patients who have mental disorders to also acquire the benefits of PWD, or persons with disability, and it can actually be that certification will be taken from the Department of Social and Welfare Development, or DSWD. But you need our you need our medical certificate for you to be confirmed regarding that mental disorder. Okay? So, yon, yung sa agoraphobia. I hope you have learned from this video, and also please share and help others subscribe as well for future videos that can be helpful. Please also comment below in order for me to know what kind of discussion or what kind of issues you are encountering that can be discussed with regards to mental health. So thank you very much for watching. Thank you for your valuable time. God bless and take care.